Alright guys, welcome to the Functional Movement Training Centre at Milton, and this is our introductory seminar. We try to do this for all our patients just to recap on the goals and technique and the methods that we're going to use to improve your back. So we've got about 9 people here today, so just briefly if you could just go around the room. I'll just pick out certain people and tell us a very brief, maybe 10-second history, how long you've had back pain. Probably back pain.
Alright. 3 years.
3 years.
L5S1. Tried everything. So.
Case, how long have you had back pain for?
Since about 75.
Long time. And Mike, what about yourself?
Yeah, 5 years.
5 years.
But I had post-op now.
Yep. And you had surgery. Catherine, how long have you been suffering back pain?
Severe for 4 years.
Yep.
And minor for probably 10, 15.
That's a long time. Okay, just a couple of other questions for you. Murray, give us a very brief summary of different things that you've tried for your back pain. What have you tried?
I've tried a lot.
Have you tried tablets? Never used tablets. Have you tried massage? Any physical therapy at all? Zero. Have you changed the way you do things at home because of your pain? Modified activities, restricted activities. Okay.
So you use like propping.
Yeah, you modify the way you do things. So you see Murray's adjusted his lifestyle because of his pain. So he hasn't tried any super invasive therapies or injections or surgery, drugs, but he has had to modify the way he carries out his normal daily activities. And what things have you tried? Very briefly.
Almost everything.
Everything?
Yeah. Except for this.
What's the most invasive thing that you've tried? Epidural, so an injection, and someone sticking a needle into your spine to sort of napalm pain generators. That's pretty invasive. The case?
The only thing I haven't tried is this CrossFit. I've tried acupuncture. I've tried stretching on the rack, all the physio that they could do.
Stretching?
Yeah, they've done that for me. Like walking it out, you know that I've tried it.
Yep.
And with the painkillers, when I feel it coming on bad, I'll take one a day.
Yep. So tablets, you're adjusting the pain of the tablets.
And
what type of tablet would that be?
it's the Bufrin 400.
Ibuprofen?
Oh yeah.
So that's a strong anti-inflammatory, okay?
Yeah, that's the only thing that's touching it. I've tried, you know, what's the other one, the one that's named for you? The other one, I've tried them.
Endo?
No.
Tramadol?
They rub me out, they rub it in, not from the cabinet to an ointment.
And Lulu, I know Lulu very well. Lulu had a problem, and Lulu's actually had a major spinal decompression and fusion procedure for her back pain. And Catherine, you've tried lots of things too, haven't you?
Everything.
Everything.
You're my last straw.
This is the last straw. Yeah. So that you can see there that back pain is a huge problem in our society. It really is. About 80% of people will suffer.
And I hit a brick wall with him because he said you have to do this before I'll do anything else. So it's like, right, okay.
Yeah. Catherine put my arm behind my back and she said, do an operation on me, fix me up, fuse those rotten discs.
Just fix it.
Yeah. So, you know, it's very easy for me to say, yeah, okay, Catherine, let's go and do that surgery. Okay,
But then we go back and do the same old things.
You can see it's a real problem, back pain, and you guys have got, you know, cumulatively probably got 100 years of back pain amongst you, and you've been feeding the medical system with all these therapies that you've tried: medications, injections, physical therapies, lifestyle changes, surgery. Okay, so let's just take a step back and actually think: why do you guys have back pain in the first place? Like, why am I standing here? Why are coaches standing there with zero back pain? And why do you all have this really unpleasant history of suffering.
Because you're
What do you
all
reckon?
fit and we're not.
What do you reckon?
Moving.
So Catherine thinks it's because we're fit. Okay. What about yourself? Why do you have back pain? Mike? Not sure.
Injury?
Yeah, just lifting.
Lifting. Case, why do you have back pain?
I think it's basically ignorance of the fact of what you're supposed to do with it, because I picked up a trailer and that's where I went down with it.
Lifting,
The system brought in
Some sort of injury.
there was an injury with me, but they brought in a system of correct movement and lifting and they threw it back out again.
Has anyone been told that they have a disc prolapse or arthritis in their spine? And that's what you believe is causing your back pain?
Field back surgery.
Back surgery, that's it. So the fact of the matter is that a lot of people, well, everybody in fact, has changes in their spine that are linked to aging, and we call that degeneration. That's lumbar degeneration. And it's wrong to assume that lumbar degeneration, disc bulges, arthritis in the joints is the root cause of the back pain. And some of you, I've shown my own MRI scan, and I used to have back pain, a lot of back pain. And I've done something that has eliminated my back pain. If I MRI my spine today, it looks no different to what it did when I was suffering terrible back pain. So what have I done that's changed? The root cause of why you guys have back pain and your coaches and the minority of the population don't have back pain is movement. It boils down to the way that you move your body. Because our bodies are designed to move in a very specific way. And when we don't move in the correct way, it converts degeneration, which is normal, into what I term degeneritis. Okay? So that's a really simple way to look at it. Degeneration, not painful, normal, and then degeneritis, which is the same as degeneration, only causing pain. And when you get degeneritis, all of the other structures associated with movement, muscles, tendons, ligaments, they start to become dysfunctional as well. And your movement biomechanics starts to disintegrate, which then precipitates even more dysfunctional movement. Okay? And the whole snowballing effect of that just gets bigger and bigger and bigger until someone says, oh, you need surgery, or you need an injection, or you need morphine, ibuprofen. Now, those therapies are directed towards pain. Okay? Everything that you guys said you have tried are directed towards treating your pain symptoms. Okay? They are not directed towards treating the underlying root cause of the problem. So of course, once we do an injection, an epidural, a facet joint injection, a nerve root block, we can reduce pain, but the underlying pathology of movement dysfunction, the way you move your body, your joints, is still there. So as soon as the epidural wears off, as soon as you stop taking your drugs, guess what happens? Pain comes back again. And it's profound to me that so many people here have suffered from pain for so long, and not one health professional, allied health professional, has actually encouraged you guys to actually treat the root cause of the problem. And that's what we're doing here, is we're treating the root cause of the problem. And I've given this example before. You know, if you've got a dripping tap, it's dripping away. You can treat the problem by putting a little cup under the sink or a bucket and say, oh, I've solved the problem now. No problems. The dripping tap has been captured by the bucket. And that'll work for a little while. That's treating the symptom. Or you can think, okay, I've got a dripping tap. Let's actually fix this problem. And you might change the washer. So that's what we're doing here, is we're actually changing the washer of your problem. We're not just sticking a bucket under the tap and collecting it for a little while. Or another example, if you had a flat tire in your car, you could just drive your car slowly for a little while and you'd get through. But the other way of approaching it is to say, well, let's put a new tire on, fix the underlying problem. So every therapy that you guys have described to us today has been a sort of a band-aid therapy that doesn't actually get to the heart of the problem. Now, you're going to say as well, I know I can move, I can get out of bed, I can go to the toilet, I can brush my teeth and do the dishes. So what do you mean by move well? Okay. That is really a difficult concept for you to understand, but after doing it, even today, in the fairly short session that we've got today, you will start to realise how badly you do move, because that is what's precipitating the underlying pain. If you imagine my twin brother, identical twin, okay? He is exactly the same build as me, has the same height, has the same frame. We both love playing golf. My handicap is 9, his handicap is 27. Why? Why is there a difference between his handicap and my handicap? Because we move differently. Okay, he's no stronger, he's no more flexible, but it comes down to our neurological system and coordination. So Greg Norman moves better than me when it comes to golf. So coordination is one of the key elements to movement. And you can only learn coordination by practicing with good coaching. Now, if you wanted to become a professional golfer, you would go and see a golf coach. You wouldn't go and see a tennis coach. Both of those people are professional sports coaches. But you want to learn how to play golf, so you're going to go and see a golf coach. Now, for most of us, we don't really care about how good our golf swing is, because it doesn't matter to us. But when it comes to moving, how many times a day do you move? Sit, stand, get out of the car, bend over to a cupboard, thousands of times a week. So it is very important to us that we move well with our normal activities of daily living. And so if you want to move well to get to the root cause of the problem, who do you go and see? Do you go and see a surgeon? Right. Do you go and see a radiologist to inject into you? Do you go and see a pharmacist to sell you drugs? No. You go and see a movement coach. A movement coach that teaches you how to do activities of daily living in a biomechanically sound way. So that's the key message that I want to get through to you today. And I want you to understand that what you're doing here is very, very different to what you have tried in the past. So I'm going to just very briefly, because I know that our Captain Loz is going to get across soon.
Off soon.
So this is what I call the dying healthy triangle. Okay? Because there's 3 elements in this triangle that are key to dying healthy. And I'm going to die healthy. That's my goal in life, is to die healthy. I want to play golf the day before I die. What is really important in the triangle of dying healthy? Sleep. Okay, because we know that when we sleep, we sort of reset our body's hormonal systems, we reset our cortisol, we reset all our circadian rhythms, and without sleep, you're going to die. Nutrition. Essential. And movement. Without movement, if I wrapped you up in a straitjacket and lay you down on a couch, you would die. Okay. What is inherent in healthy movement? Now, we said that earlier before about my twin brother. Coordination. Okay, we have to be coordinated in the way we do things. Flexibility. If we don't have mobility in our shoulders or our hips or our joint capsules don't move properly, there's no way we can be coordinated. Okay? There's no way we can be coordinated. And we will, part of the program is about obtaining flexibility. But Obviously, when you start the program, you're not going to have a lot of flexibility. So we will modify coordination and range of motion to accommodate your limitations in flexibility. But we are still training you to move well. As time goes on, the flexibility improves, our range of motion of doing safe, healthy movement increases. And the last one is strength. Because supporting my spine right now and stopping me from falling over are my muscles. If I have weak muscles, I can't support my spine. Okay. My spine is what's holding me up. When we obtain these first two, coordination and flexibility, we can build the strength over time. Okay. So once you finish the program, you're not going to stop doing functional movement training. Every single thing that you do in life will be an opportunity to build strength, because we know you're going to move well, we know you're going to be flexible, and that's going to continue to improve in time. And when you do the dishes, when you go gardening, when you pick up the shopping bags at Coles, you're going to be building strength. It's not going to be something that hurts you, it's going to be something that actually makes you stronger. Right? So everything in life then becomes a positive thing. Every physical activity becomes a positive thing rather than a negative thing. Okay. Now, that's our triangle of health. One last thing before we crack into it is what do we mean by functional movement? We are going to teach you movements that have the term functional movement. It's a bit of a buzzword, and a lot of people don't really know what functional movement is. The key element in functional movement is that they have the ability to express power. Expression of power. So there's no point me giving you a movement such as flicking tiddlywinks or playing marbles or just doing bicep curls. That does not have the ability to express power. Okay. Now does that make any sense? Why do I want you to express power? Or what is power? Power is the rate of doing work. Okay. Power is the rate of doing work. If I get Michael to walk up those stairs, and I say, okay, Mike, you've got 5 minutes to walk up those stairs. You're going to go up those stairs really nice and slowly, and you'll have done X amount of work, kilojoules. If I then say to Michael, okay, Mike, you've got 3 seconds to walk up those stairs, you're going to have done the same amount of work, exactly the same amount of work, because you've moved it a certain distance, a certain weight, a certain distance, and that equals work. But if you do it in 5 minutes versus 3 seconds, how do you think your body's going to feel after having done it in 3 seconds compared to having done it in 5 minutes? What's the difference in the way that you're going to feel?
Bushed.
You're going to be bushed, you're going to be tired, you're going to be puffing and panting when you get to the top of the stairs. And that's because the 3-second ascent has expressed a greater amount of power than the 5-minute ascent. And that is what we term intensity. That is equated to intensity. The more power output, or the rate of doing work, the amount of work done per unit time is equivalent to intensity. So the more power we generate in your training, the more intensity that you will generate in your training. And that is also something that is highly deficient in the rehabilitation industry. Highly deficient. And John and P will attest to that. A lot of physiotherapy, a lot of rehabilitation is done at very low intensity. What's the first thing you do when you go into a studio? You lay down on a couch. Okay? And most people would have gone into a studio and lay down on a couch. You cannot generate power or intensity when you lay down on a couch. It's not possible. Or even Pilates and yoga and those type of activities, you cannot generate power and intensity. Why is that important? Why do we want to generate power and intensity? Because we want your bodies to change. We want your bodies to change, i.e. get stronger, get more flexible, get more coordinated. We want to stimulate some adaptation. And intensity stimulates adaptation. And that's very well proven in the scientific literature. Okay? Intensity stimulates adaptation. We can measure we can do blood tests on people after doing 1 minute of exercise, and we can do blood tests on people after doing 1 hour of exercise. And if we've done the same amount of work in 1 minute versus 1 hour, guess what happens? The blood tests show us an entirely different spectrum of hormones, an entirely different spectrum of hormones. And we want those hormones to be high because those hormones are what regulate the changes that you'll see in your body. The growth hormone, the cortisol, the dopamine, these are all hormones that make you feel better. And we have a secret formula of movements that are powerful and generate intensity and therefore generate adaptation. And adaptation means, bingo, I can now go and play golf without pain. I can go and do the shopping without pain. I can garden without pain because you've adapted. Fantastic. That's all I want to say because the coaches are itching to get into it. If there are any questions, any burning questions, excellent, because you can always ask me questions at the end of the program. I'm going to be here fairly regularly as one of the coaches as well. So let's get into it.
Alrighty, thanks, Doc. Okay, ladies.